is an economic driver, and I think it's going to be a major election issue.
All right, well, let's get into it. So this week, the NDP put out its long-awaited election platform. It's 97 or 98 pages. It was launched at an event with party leader Andrea Horwath. Many of you, I think, or all of you, were in the background there with a number of candidates as well.
It was well supported, yeah.
So it was a big event, and let's just touch on some of the main kind of high-level themes in the time that we have. So your commitment to pharmacare, which your party had articulated previously, about a year ago, I think, just prior to the 2017 budget, for all ages, all people, regardless of income, but for 125 drugs.
That's right, and the 125 drugs cover 91% of the most used drugs in the current slate of prescriptions that are available. And the age factor actually really does matter, because when you look at the impact and the return on investment for actually bringing in a pharmacare strategy, the blood pressure, the diabetes, the cholesterol, heart disease, these are some of the key issues that actually end up being chronic diseases. And so there's a long-term cost to our healthcare system, because 1 in 4 Ontarians doesn't have a plan, doesn't have access to the prescriptions. So they actually have half of the equation. They go to the doctor says, you know, you have this serious health issue, you need this medication, and they're cutting their pills in half, or they're not accessing those medications. So we see this, the healthcare budget is massive. We have an aging demographic in the province of Ontario, and so we looked strategically at how we could impact the healthcare budget in a positive way, making the lives of Ontarians better.
Sure.
And then also be upstream a little bit, instead of just catching and reacting to what is some chronic diseases that are affecting the healthcare budget.
Okay, and so the NDP also put out in their platform dental care, which is not new. You had articulated this before, including, I think I saw opening 70 dental clinics in public health units.
Absolutely. I mean, because if you're going to create a strategy where people have more access to dental care, then you have to address the need, the availability of those services. And so we do have some rural and northern communities that don't have the availability for dental care. And so our dental care plan would address the 1 in 3 people who don't have access to dental care and dental coverage. And Ontario is actually quite unique in this, in that when you look at the overall health of an individual, for some reason, oral care was not considered to be health care. And if you've ever, experienced that kind of pain, or that sort of chronic illness with your mouth and with your teeth, it impacts your ability to get work, it impacts your ability to work. And right now, the overall healthcare budget is 38 million of people going to emergency rooms just to deal with the pain. So there has to be a better way, and the Ontario Dental Association and dentists across the province, I think, recognize that it's time for Ontario to address dental issues.
Yeah, certainly. I mean, we full disclosure, we do some work for the ODA, and they have some certainly lots to say that I'm sure they've shared with you and Frangeliana and your leader. So in the platform, there's funding enhancements for hospitals, for long-term care, for home care. Mental health, I thought, was interesting. Mental health seems to have caught fire lately, and I think your party's actually proposing a separate, distinct ministry for mental health.
So right now in the province of Ontario, 11 ministries have a component of mental health, and so that's 11 ministries that have a whole layer of bureaucracy, and that impacts our ability to fund frontline services. This actually was a recommendation from an all-party committee back from 2010. And this is another one of those committees and select committees that the Liberal government never took action on. But they went through the process of consulting and doing the research and gathering the evidence, but didn't act on. And so we see this one mental health ministry as a way to really focus attention and be proactive, early intervention as a focus as well, and really a better use of funds. Mental health is 1 in 5 Ontarians actually have personal experiences with mental health, be it our children or family members or co-workers, and it's time for this.
Okay, so we saw that the NDP included as well for those people who have student loans, that those loans would be converted, essentially forgiven,
Yes.
and converted to grants to make post-secondary education more affordable, and won't have people graduating after 4 years with
Massive.
mountains of debt.
Massive.
So just around the office here, when as the platform came out and we were going through it and reading it, it was so that some of the, at least thematically, some of the big ticket items do have something in common with the provincial budget that we saw at the end of March. There are enhancements to hospital funding, there's pharmacare initiatives. The details are different, who's covered and for what and for how much, and how much money is allocated to each. Childcare was one where the government has signaled big expenditures in childcare. I think your party has come out and said for people or households, I guess, earning up to $40,000 a year, childcare would be free. And if people that earn, I guess in the next level, I didn't see what the next level is.
It means tested to up to $12.
$12 per day per child.
That's right. And one of the reasons that we really focused on childcare, so you're quite right, pharmacare and dental care and access to quality, affordable childcare are really the anchors, I think, of our platform. But the childcare piece has been a long time coming, and obviously 28% of the women in the province of Ontario identify that they only work part-time because they only can access part-time childcare. So there is really a lost opportunity from an economic development perspective, from a gender equality and economic equality perspective. And so we are being very ambitious. I mean, we want to create 200,000 new childcare spaces in Ontario. The Liberal government has been talking about this for 15 years. And so you referenced that the budget that they came out the budget that they came out with about 3 weeks ago, it's had everything, as my mother says, it used to be a chicken in every pot. This one has a unicorn in every backyard. It's like this realization that all of a sudden this Liberal government recognizes that people are hurting, and they're asking people to believe them. And quite honestly, that's a huge credibility issue. And so just in question period today, the Liberals were coming in for the hug. We reject that hug entirely because we don't feel that the budget that they've tabled is a credible budget. We don't think that they've earned the trust of the people of this province, and we will not be supporting it. We have our own plan, and that's why it was so important for us to come out with our platform, to give the people of this province a clear direction as to what an NDP government would look like, what our priorities are, because those priorities reflect the people of this province.